Hello, Fighting Atheist. I've been a subscriber of yours, and I've always loved your videos on atheism and everything, which is why I'm posting this response because I don't want to see you making the same mistake that a lot of other atheists make. That is, being skeptical when it comes to religion and nature and everything like that, and then throwing it all out when it comes to politics. I've seen a lot make that mistake, and they end up not even realizing it, using the very same arguments that a lot of creationists use, and yeah, don't even realize it. So I'll touch up on what I can for this vid. First of all, you're making when you support socialized healthcare, you're making the same mistake a lot of others make. They judge it based on its intentions and not based on its actions and its consequences. Now, I'm sure we can all agree you can do terrible things with very good intentions, and you can do great things with very selfish intentions. We all know this. So intentions don't really matter. What matters is actions and consequences. And as a Canadian myself, I've seen the consequences of socialized healthcare. I read it in the paper all the time. People waiting in line for long periods of time, decreased quality because of government rationing, because because you eliminate the incentive and you eliminate the ability for others to get into the field easily, you restrict the supply, and so the supply has to be rationed. Now, when you talk about critics of socialized healthcare, you make them out to sound like that they want the poor to suffer and things like that, which is it's ridiculous, really. I mean, nobody, unless they're deranged, wants the sick and the poor to suffer. That's not the reason why we oppose it. We oppose it because we don't believe it works. We believe there are many alternatives, and socialized healthcare cuts off those alternatives. And we're not opposed to pooling their money together for a common interest, whether it's healthcare or whatever. Because the truth is, people were doing that long before government took over it. They were called fraternal societies. They were very common back then. Some group of people would pool their money for medical services or many others. These worked out very well. In fact, back then you could get full years of medical coverage for about 1 day's work a year. It was very good. But what happened was when government took over it, and so yeah, what basically happened was government didn't give people anything. All they did was take what was already there and give themselves a monopoly on it. And what happens with monopolies? Increased prices, decreased quality. I mean, we hate monopolies when businesses do it. I really fail to see why it's okay when government does it. It doesn't make any sense. We don't want people to suffer. We don't want people to go without health care. What we don't want is government having a monopoly on solutions. We don't believe government is qualified to do it. We believe that people should be allowed to run their healthcare however they want to. It should be an issue simply between the patient and the doctor. They're the ones making the deal, and they're the ones who should be deciding how it's best done. Insurance companies don't make good middlemen for it, and I really don't see how government is going to be any better at it. So, it's not that we're against people getting health care. It's that we're against people's options being restricted, and that's exactly what socialized medicine does. And we're not just calling it socialism, it is socialism. Read up on it. It's very clearly a socialized system. Socialized failed when it was done before, and what reason is there to believe it's not going to fail this time? People talk about how great it is in Canada and everything, but the truth is, every day I thank my lucky stars that I don't have any pre-existing medical conditions, because I've seen what a lot of people who do have to go through, and it's horrible. Waiting 6 months in absolute pain just to get surgery. A friend of mine, under our system, he would have lost the use of his arm because our system would have had him wait 6 weeks between 4 surgeries he needed to fix his arm, and he would have lost it in the process. So he's got plenty of reason to be glad that the U.S. doesn't use socialized healthcare. And a friend of mine down in the U.S., he just went visited the doctor and he was hit for more than what it cost for my laser eye surgery. There's your proof right there. Laser eye surgery is not covered by socialized medicine, and yet it's actually getting cheaper. You can check this all out yourself. So, I think that about covers it for now. So, don't judge, don't call people who don't like socialized medicine as heartless or things. That's really a low blow, and it's not true. We do care about the sick and the suffering. That's why we oppose socialized medicine, because we believe it doesn't work. It's just that simple. So until next time, be aware and be wise.